One more piece of America's healthcare system deserves its own discussion. This one is not a fourth major healthcare program like Medicaid, Medicare, or private insurance. Instead, it is an example of how different healthcare systems can overlap. If you're a veteran receiving healthcare through the Department of Veterans Affairs, VA, one of the biggest questions you'll eventually face is surprisingly simple. If I already have VA healthcare, do I really need Medicare? Many veterans assume the answer is no. The VA itself says otherwise. In fact, the Department of Veterans Affairs strongly encourages eligible veterans to enroll in Medicare Parts A and B when they become eligible. That advice surprises many people, but it makes sense once you understand how the two systems work. Two separate healthcare systems. The first thing to understand is that VA healthcare and Medicare are completely separate programs. They do not coordinate benefits the way two private insurance companies sometimes do. They do not split the bill. One does not automatically pay what the other leaves behind. Instead, each system operates independently. If you receive care at a VA medical center or through VA-authorized community care, the VA pays according to its rules. Medicare is generally not involved. If you receive care from a physician or hospital outside the VA system that accepts Medicare, Medicare pays according to Medicare's rules. The VA generally does not reimburse those costs simply because you are a veteran. The responsibility for deciding which system you are using rests largely with you. That may sound complicated, but it is simply the result of two independent healthcare systems serving the same person. Why Medicare Part B still matters. One of the most expensive mistakes a veteran can make is assuming that VA healthcare replaces Medicare. It does not. VA healthcare is not considered creditable coverage for Medicare Part B. That means if you delay enrolling in Part B because you already receive care through the VA, Medicare may impose a permanent late enrollment penalty if you decide to enroll later. The penalty increases your monthly premium for as long as you have Part B. For that reason, the VA itself recommends that most eligible veterans enroll in Medicare Parts A and B when they first become eligible. Doing so preserves your options. If you need care while traveling, want to see a specialist outside the VA system, or simply prefer a non-VA provider for a particular medical issue, Medicare gives you that flexibility. Prescription drugs are different. Prescription drug coverage follows different rules. VA prescription drug benefits are considered creditable coverage for Medicare Part D. As long as you maintain your VA drug coverage, you can generally delay enrolling in a Part D plan without facing the late enrollment penalty. Many veterans continue using VA pharmacies because prescription costs are often very low, particularly for service-connected conditions. As with the rest of the healthcare system, however, the best choice depends on individual circumstances, including where you receive care and which medications you take. How Medicare options fit in the Medicare choices discussed earlier still apply to veterans. If you choose Original Medicare, a Medigap policy can help pay deductibles and coinsurance for Medicare-covered services received outside the VA system. It does not apply to care provided through the VA because Medicare is not involved in those claims. If you choose a Medicare Advantage plan, the plan covers your non-VA healthcare according to its own provider network and rules, while your VA benefits remain available separately. Some Medicare Advantage plans even market additional benefits specifically to veterans, but those plans should be evaluated carefully to be sure their provider networks meet your needs. Using both systems, many veterans eventually develop a practical routine. They rely on the VA for care related to service-connected conditions, routine medical care, prescription medications, and services the VA provides particularly well. At the same time, they keep Medicare available for health care outside the VA system, including physicians closer to home, specialists, emergencies, or care received while traveling. Rather than replacing one another, the two programs complement each other. The bottom line: healthcare is one of the nation's most valuable healthcare resources for eligible veterans. But it was never designed to replace Medicare. The two programs serve different purposes, follow different rules, and operate independently. Understanding how they work together gives veterans greater flexibility, helps avoid unnecessary penalties, and makes it easier to receive care when and where it is needed. Like so much of America's healthcare system, the goal is not choosing one program over another. It is understanding how the pieces fit together.